and welcome to the Deuk Spine Institute's live stream of spine surgery today on April 20th, 2023, live streaming from Florida. Today we're going to be, in this case, working on a patient who has a herniated disc in her lower back at L5-S1, and there's also degenerative disc disease, which is a collapsed disc. It's about 80% collapsed. How are we doing, guys? All right, we're going to get started. First thing I'm going to do, and I'll talk a little more as we move along, is I'm going to put a little bit of numbing medicine. Just lay down. You're doing great. Dr. Deuk, I'm going to be giving you some numbing medicine, okay? I'm just feeling around a little bit. You're going to feel a little stick and burn. That's normal. Don't move. That's just the medicine going in. And I'm sure you could appreciate le peau d'orange, the orange peel. She speaks French. Yes, it's okay. That's medicine. That's all. You're doing fantastic. Everything's okay. We're going to just wait a minute for the medicine to take its effect. And everything's looking pretty good over there. All right. Remember, we're fixing the L5-S1 disc. I have to get through the ioband, which is plastic. It has a barrier impregnated with iodine to minimize the risk of infections. Shot? You're okay. Yeah, we'll go a little bit further south. Let's do some num-num. I'm going to give our patient a little bit of numbing medicine to make it more comfortable for her. And shot? Oh yeah, that's better. That's numbing medicine. Everything's okay. You're doing great. Nothing wrong. Everything's fine. Incredible, huh? Just from the injection. So, all right, that's where we are? Yes, sir. Fantastic. So if you looking at the x-ray, you can see how close we are already to where we need to be. We're making good progress. You're okay, Shot. You're doing great. Everything's fine. Shot. Shot. You're all right. I want to be a little bit more south. Shot. That's too south. Shot. Very close to where we need to be. Shot. You're doing really good. Just hang in there. We're going to put you to sleep in just a minute, okay? Shot. Where do you feel that?
Where are you feeling it?
Probably in the back.
Your back or leg? Back.
AP. You're doing great. We're almost done. We're going to put you to sleep in just a few minutes.
You're doing great, my friend.
Perfect. It doesn't get any more perfect than that. Let's show us why it's perfect, Jordan. You're going to enjoy the video. Let's go, George. Come on. Tip of the needle. Where do we want it? We want it between the pedicle of S1 and the pedicle of 5. There's S. Show us S1. There we go. Big circle. Show us 5. There, bigger. 5. Yeah, that's 5. And the mid pedicle, there to there. So we're right on the edge of the disc, right where the herniation is. Just relax, okay? Can you hear me? Lay still. Don't move. You're doing great. All right. Shot. Uh-huh. So far she's doing really well. Try to relax a little bit. You're okay. There we go. That's what happens when you have a collapsed disc. So, you're okay. Have you had back pain all these years? How many years have you had back pain for? 6 years. All right. So 6 years of back pain. Lower back pain. And if that's not enough to get people to come see me, she also has left leg pain. Left lower extremity sciatica. Can you guys see here? Don't we need something on, or is that it?
No, it's better like
All
that.
right. So we know that her L5-S1 disc is the problem based on her localization of pain. Hey, where's your pain? She showed it to me. It was right here. And I know from the MRI there's a bad disc with a tear. Plus there's a herniation pushing on the nerve on the left side. So it all made sense. Are you comfy?
You doing okay? Yeah.
All right. How many of my surgeries did you watch before you came here from Switzerland?
A lot, she said.
A lot. All right. How bad is that on a scale of 1 to 10? How high does it go?
0 to 10.
What's the highest it goes? Just give us a number.
What's the number? 5.
I thought I heard her say 10. Huh? How high does that go on a scale of 1 to 10? 10? Hard for me to hear her, but she was saying ow, ow, ow. So I'm going to call this the ow, ow, ow. And she says it's a 6 out of 10. Is that where you get your back pain? Yeah, concordant. All right, good. At this point, we're going to put you to sleep, okay? So just count out loud from 1 to 100 when you wake up. Surgery is going to be done. And folks, the reason I have to talk loud is so the patient can hear me. She's actually under the drapes, so it's very hard for her to hear. And now that, let's do a little more numbing on the skin. I'm going to give her just a little more num under the skin to ease this incisional pain. And you heard me right. She's traveled all the way from Switzerland, Geneva, Switzerland, the banking capital of the world, to Deuk Spine Institute.
Said she had a long flight. She had to go to Toronto, then Amsterdam.
Yeah. And I used to travel from Europe to Florida back and forth as well with my son when he was racing over in Europe. But she came here for one purpose, to get the Deuk laser disc repair. I know that she traveled to other places, such as Abu Dhabi, or Dubai actually, I mean, and even London. And we were talking, and she was telling me that at London, the London Spine Institute, they were telling people they do the Deuk laser disc repair now. Really? Yeah, to get people there. And then once they get there, she asked them, are you going to do the Deuk laser disc repair? And they said, no, we have a different technique we do. So basically, they're just using our name of our procedure to get people to go to London Spine Institute. And then once the people get there, they bait and switch them, which is, to me, the most unethical kind of people in the world. I can't stand liars.
Especially if everyone travels so far.
Yeah. So she's been all over trying to find the Deuk laser disc repair, and I guess finally she decided to come to Deuk Spine Institute where it was originated, which we're happy about that. She's not going to be an easy case. They try to sell her on fusions, and they recognize, hey, this is a hard surgery to do endoscopically, which she wanted the minimally invasive, and she's going to get that, but only here at Deuk Spine. So they tried to bait and switch her to a few other places, but she was too smart for them, and here she is. You can see the tip of the dilator now is at the facets. I want her to be very comfortable. Let me know when you're ready. Yeah, because she's going to be hard to get into. Sean? Any questions from our audience?
No current questions, but we do have a comment from Canes25 on YouTube.
Yes, Keynes, how are you?
And they said, Doc, you have to check out the horror movie trailer Nefarious. It looks like a popcorn theater must. It's about an ancient, giant, nasty vampire.
An ancient, giant, nasty what now?
Vampire.
Oh, well, nice. All right. I'm going to check it out. Thank you. Thanks for sharing. One of our viewers knows that I like horror movies and is recommending one for me. So at this point, because I'm going to tell you guys something, if you want to do this kind of surgery, you want your patient really comfortable at this point because you're trying to get into a really tight space. And yes, I've got a special instrument and it's going to spread things apart. But literally, I have to force the bones that are almost sitting on top of each other. I got to force them apart to get into the disc to fix it. So I'm going to be real patient with my anesthesiologist. I'm going to move slowly and make sure our patient's very comfortable, not feeling much pain. But I'm right at the back of the disc. I'm almost ready to go in, and I just want to take my time and do it right. I want this to go perfect for her. She's traveled halfway around the world to get here, and I want her leaving very satisfied and happy. So, as we do all of our patients. All right, making our way down. It looks like I need to tilt my dilator a little south. Yep. She is a thin lady. She's not a big person. And she doesn't have any body fat, for that matter, that I can see. I thought about giving her some of mine. All right. That was a joke.
Yeah.
You're supposed to laugh, people. Okay? Boy, my hammering is not so good today. All right. Yeah, she's clamped down. So we're in. But before you do that, I think we should lubricate.
I put some water in.
You did?
Yeah.
So I can tell you right now, this is going to be a tough one because it's so hard to get into that disc space. The reason why it's difficult to get into her disc space is because there's been so much inflammation for 6 years now going on in the disc that there's all this scar tissue basically grabbing both bones and holding them down on top of each other. So the more relaxed I can get her muscles, I'm feeling her muscle tone right now. It's feeling pretty good. I think honestly the muscles are as relaxed as we're going to get them. I don't think this is a muscle issue. I think what we're dealing with is just the scar tissue. Yeah, no, that's great that she's deeply asleep, especially right now because this is the hardest thing to do. Huh? That looks good, Luis. Let's see if we can get it out. It's going to be a tough one. You got the CPAP on? You're happy? So what we've got is a severely compressed disc space from years of inflammation and scar tissue. On top of that, we've got a herniation that's pushing on the nerve, which we're going to remove. And like I said, we're just going to take our time and make sure we get it done right. You want to come over here?
I can. Yeah.
We have a question.
I'll take the question.
This comes from Lupisa on Facebook.
Hello, Lubisa.
They ask, hello, is annuloplasty similar to your method, endoscopy with annuloplasty?
That's a great question, Lubisa. I don't know the answer. Annuloplasty just means to change the shape of the annulus. So we actually do an annuloplasty as part of our surgery. Twist. The key is to twist first. Shot?
You want to heat it a little bit more? Or no? Like
Sure. The annuloplasty, it really doesn't, it's not the same procedure, by the way. but it just means to change the shape of the annulus, that's all. Let me try. So what we do in the Deuk laser disc repair is actually a debridement of the annular tear, specifically removing things like scar tissue and calcium deposit shot. Whew, it's a tough one. Shot, I don't see it moving that much. Want to try again?
I want to try something to taste it first.
Man, that's tough. We're going to use a vice grip. You know it's going to crush those holes inside. It's fine. If we crush it, we crush it. But try to put the towel above it so that it helps with the compression. Sorry, it's such a collapsed disc space that we're having to get the vice grip out. Any luck? You know how to use this, right? You're supposed to clamp it. It should lock. I'm not moving. I'm good. Are you moving?
But it's not moving.
It should be. As long as it's moving, you can start pulling it backwards. No? No movement? Let me see. Sorry, folks. Having to try to get this thing out. Well, I probably ruined this, but it's okay as long as the patient gets well. But it is about $2,000 for this stupid little metal pencil. It's not our fault that they charge so much, but they do love to overcharge for these things. Well, we'll see. You'd be surprised how much this stuff costs. It's all made in Germany, which honestly it's the best quality there is. Maybe Germany or Japan, but in my opinion that is. But at the same time, the Germans love to, their engineering is not cheap. But we're good. I'm happy we got it out. And there you are, folks, the L5-S1 disc space. You can see how inflamed it is. Look at all the red. That red is from inflammation. Why is there so much inflammation? Simple. She has a herniated disc. Herniated disc cause inflammation. That's where all the pain comes from. So I'm so happy we're here. We're getting this done. These are all little pieces of herniation. That blue stuff. Thank you. I don't think you have to worry about it coming out. There's a piece of herniation. Great. So it's going well for her. I'll take any questions, by the way. But you got to see for a moment that we struggled. And it didn't go perfect, right? But we didn't give up. We had a solution, and we were prepared. And that's the key in life, is you have to be able to anticipate problems that can happen. And you have to be prepared. You have to have what the things you need available. And in this case, a vice grip. And that vice grip, yes, it comes from Home Depot. All right? But it's sterilized and ready to go. And we used it, and now everything's going well. So, any questions?
No current questions, but we do have a comment from Canes25 once more on YouTube. And they said, when you're done, she'll be able to jog back to Switzerland. She made the right decision.
Yeah, thank you. That's cute. I don't know that she can drive back to Switzerland from Florida, but she can maybe sail. Yeah, I think she made the right decision. She went to, I believe it was Dubai or Abu Dhabi, one of the two, and the United Arab Emirates, I think. And, you know, they didn't have anything advanced there. We actually get patients from United Arab Emirates calling us to come here and get surgery on their spine. There's nobody there that does this surgery. We actually had a patient who works for the king over there, and he's a doctor working for the king in Dubai, and he had thoracic disc herniation he wanted treated. So, all right, we are just here where the herniation is the worst, and we're going to get it with the laser. In the meantime, let's show our audience how does the Deuk laser disc repair actually work.
Traumatic injury to the disc can cause annular tears to form. Pressure on the disc causes herniation of the nucleus pulpus through the annular tear. Inflammatory disc herniations are a common cause of chronic back pain. The inflamed annular tear causes back pain. Inflammation of the nerve roots causes leg pain. A Band-Aid-sized skin incision is made. A small tube is inserted without damaging the bone or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own. If you have a herniated or bulging disc and back pain, submit your MRI for a free review at www.mri.deukspine.com.
All right, welcome back. So far, so good. We haven't had any problems. I will tell you that, you know, the dilator got stuck with the tube a little bit, but we got it worked out. Here is the back of that herniation right there at L5-S1. So we are literally already at the back, and the reason why it's going so quick, she doesn't have much disc. There's not much to take out, but this is it right here. The yellow thing is most of the herniation. We've gotten about 50% of it. Remember what I said before, you don't ever get all the herniation. Doctors cannot get the whole herniation out. It's impossible. But we get, if we get 50%, then the patient's going to do fantastic. If you get more than 50%, that's better. I try to get as much as I can safely, which on average I estimate will be about 70% of the herniation. If I'm really, really lucky, I might get 80% of the herniation out. And if I'm truly an amazing surgery for whatever reason, I might get 90. I don't think I've ever gotten more than 90% of the herniation. I don't know anybody that's gotten more than 90% of the herniation. It's just not possible. So that's something that a lot of people don't understand. They think you have to get 100%, but you don't.
Is she better?
She's great. Yeah, no, she's not moving at all. It's perfect. And this is so scarred up. You guys see how thick that scar tissue is there? That's not normal. I'm going to try to go in and grab some stuff out. And the reason why things are a little milky or hard to see, simply because there's a little bit of bleeding, very minimal, but enough to cloud the water. And the reason for that is that there's so much inflammation, right? So bleeding comes from blood vessels, and inflammation, chronic inflammation, actually recruits more blood vessels to the area that the inflammation is happening. So inflamed areas of the body, chronically inflamed areas of the body, have a surplus of blood vessels that are recruited by what are called, sorry, I'm just focusing here on the surgery. What are called, help me out here, Dr. Berndes.
Angiogenesis.
Yeah, well, it's angiogenesis factor, but they're called cytokines. Cytokines. They're basically small molecules floating around that your cells release, tissues release, in order to elicit a response, a physiological response. And cytokines are what we're talking about. So there's a lot of blood vessels that grow into the area of chronic inflammation that are induced to come there by cytokines, like angiogenesis factor or EDRF, endothelial-derived factors. So that's why there's so much inflammation going on in here. All right, not bad. Probably 2 more minutes, I'm thinking. These are bone spurs, by the way. A lot of this is bone spurs that I'm removing. And I'm going to need to bring the grabber in again. A lot of this is calcified. This disc injury is old. This poor woman must have suffered with this for a long, long time. This is far older than 6 years. She says her symptoms of back pain were 6 years, but I can tell you this disc injury is at least 20 years old. So she may have had a period of time where there were not so many symptoms. You know, for the last 6 years she's been symptomatic, but I think the injury goes back way before 6 years. She had an injury in 2005. Oh, 2005? Yeah. I think that's probably what we're dealing with then. The good news is you can see the epidural space right there where those blood vessels are moving around right there. And that's where the traversing nerve route's going to be. The exiting route will be just north of where I am. And we're going to look at that in a minute. But right now I'm pretty happy with the progress that we're making. I need to get my retractor just a little bit more medial. I think we're probably at about 60% of the herniation at this point. She's definitely not going to be a 90%. But everybody's anatomy is different. There's the nerve right there. You guys see it? The white nerve? That's the L5 nerve root at L5-S1. And the S1 nerve root's going to be up there at 12 o'clock. Okay, we don't see it. I need a minute. See how there's no disc left? It's literally totally collapsed. So what I'm doing is debulking. I'm taking the bulk of the abnormal stuff that's pressing on the nerve, taking it out. 30 seconds, I'm pretty much done. I don't see any more herniation here in the lateral recess or foramen. And I feel like her back pain is going to be gone based on our results. And I think her leg pain is going to be gone as well. And there's the nerve again right there. A little bit of fat and some veins on top of it. But you can see it's been decompressed. And I just want to get this last little bit right here. It's really important when you do this, you don't pull on the scope. That's how you break the scope. I'm just pulling on the tube. So for those spine surgeons out there watching, don't pull on the scope, pull on the tube. All right, we're done. Surgery went well. There goes betadine's antiseptic. We'll clean it out. So once again, our patient is from Switzerland, and she came to Florida she tells me for me, but most people come here for Mickey Mouse. I'm not jealous. Mickey Mouse has been around longer than me. It's hard to be jealous of a cartoon anyway. Guys, I'm getting you out of here early. You guys should be laughing at my jokes. Don't make me add some more surgeries on. No, this operation is no Mickey Mouse. I love it. All right, all done. So we probably lost about 2 cc's of blood, which is nothing. I put pressure because the veins sometimes bleed, and if you put pressure for a few minutes, you keep it from bleeding. All done. I think she's going to be very happy. We'll find out when she wakes up and she starts getting around, but surgery went very well for her. I don't expect any problems. I saw the nerves that were right next to where we were, and we got the herniation out of there. So I think she's going to be happy. I expect the surgery to last her lifetime. People ask me that, how long are the results going to last for the surgery? It's a lifetime. The only way she's going to have problems, in my opinion, is if she does something to re-injure her disc, which I don't think is going to happen. Her disc is pretty damaged. It's pretty much gone. All the jelly's pretty much gone anyway. So trying to get another herniation with a no jelly in the disc is going to be hard to do. So I think she's going to be okay. Any questions?
Yes, we have 2 questions and a comment.
All right, well, let me answer the questions when I come do face-to-face. Let's take a look real quick. Can you all see this?
Yes, we can.
There, the whole surgery was done through that little cut right there. Tiny, tiny little cut. It's about 8 millimeters. You got this? All right. So I'm going to come answer your questions, type them up. And this is our last surgery for today. It was a Deuk laser disc repair, left L5-S1. Hope you enjoyed it, and I'll answer your questions for you. In the meantime, let's hear from one of our lower back surgery patients that had the Deuk laser disc repair for the same problem. I'm Dr. Ari Deuk-Machen at the Deuk Spine Institute, here with a patient from Virginia who came out to the Deuk Spine Institute yesterday for surgery, and we fixed 2 discs in his lower back. You were having back pain for some time. Do you still have that same back pain?
No.
Gone.
I feel my back feels 100% this morning. I was able to sleep in the bed, laying flat for the first time in 2 months. I was sleeping on the couch for those 2 months, and I did not get good sleep at all. So I feel great in my back.
Good. Well, that's why we're here. We wanted to cure your back pain and give you quality of life back. What was life like living with that back pain?
Any day you'd be like, it could happen today. I could go down with back pain, severe back pain for a week. And that happened. My first pain started about 5 years ago. I was working in the flower garden. I went down with severe pain. I was down for probably a month that time. And ever since then, it was just like randomly, just out of the blue, I'd go down for another week with severe back pain. It was just no way to live because I knew every day waking up it could happen today.
Yeah, it is no way to live because then you got to be careful every day. You don't set it off. You're worried about it. You're thinking about it. It takes control of your whole life, that back pain. His back pain happened to be coming from 2 discs. And did you see any other doctors? Did they recommend treatment for you in Virginia?
Yes, I was seeing chiropractors for the first number of years. The first chiropractor, he put me on this decompression table, and he would, pull you apart. I did that for 6 weeks. I felt a little relief at first, but it didn't last very long. And I've been seeing just regular chiropractors throughout the years as well. And then when this happened, I saw an ortho doctor. He did not recommend surgery. He recommended physical therapy. He said surgery it's like a coin toss. It either works or it doesn't. And that was not good enough for me. I needed, I needed a little bit more reassurance that it's gonna work. That's when I started looking for other options, and I had a lot of time on my hands. I did a lot of research, and I found Dr. Deuk here, and I started watching his videos and testimonials. Made up my mind right there. It was without a doubt, that was my choice right there. I submitted my MRIs, and within 2 days I did my virtual consultation with you, and 10 days later I'm here.
Yeah.
And it's amazing. I had an appointment with an orthopedic doctor in Charlottesville, and that was February the 2nd for my first visit, just for a consultation. And who knows how long it would have gone after that.
Years.
And yes, I'm done now. It's just, I'm back to recovery, you know.
Yeah, the problem is, unfortunately, the vast majority of doctors treating back pain don't know how to cure it. They just don't. And if I had to put a number on it, I'd say 99% do not know how to cure back pain. It really comes down to two things. You have to make the right diagnosis. Where is the pain coming from? Most doctors really don't even know it comes from the disc, and that's where it comes from about 90% of the time. Then the second problem is knowing how to treat it. And the treatment that works, the only treatment that works, is surgery on the herniation, really. And there's two surgeries that work, fusion and the Deuk laser disc repair. I've done fusions for years. I've cured people's back pain with spinal fusions, but that's a big, bloody, messy surgery with screws, rods, cages, long recovery. You're on opioid painkillers for months, like 3-6 months, just taking painkillers, just getting over the pain from the surgery. Not the back pain, pain from the surgery. So when we started doing the laser surgery, people weren't having any back pain afterwards. They'd have just a little discomfort for one night. We realized they didn't even need the opioids anymore. So our laser patients don't get any painkillers except Tylenol and usually 1 or 2 Robaxin. So you did it. You happy you did it?
I'm very happy.
Yeah. And you can see in the surgery that we did, we actually got into your disc. We used the laser to clean up those tears at L4-5 and L5-S1. Surgery went really well for you. We didn't have any problems. It was just a tiny Band-Aid incision on your back, and that's why you went home an hour later, and that's why you're here today, ready to go home. Where are you guys heading back to Virginia?
This afternoon.
Driving?
No,
Flying?
we're flying.
Flying out of Orlando?
Orlando.
Awesome. Anything you want to say to your friends and family and people you know out there?
Yes, living in pain is hard. It's not a way to live. And I recommend Dr. Deuk any day.
Well, thank you. I appreciate that. You had faith, and you're going to be rewarded for that. Congratulations.
Thank you.
All right. Good to see you. And I hope you enjoyed watching one of our patients who had the Deuk laser disc repair express their sentiments about their care and how they're doing. The Deuk laser disc repair is a surgery designed to eliminate back pain that comes from herniated discs. And that happens to be the most common cause of back pain in patients. In this particular patient, she's had 6 years of chronic back pain she's had to deal with. And by the way, I don't know if you noticed, but she's very thin. She's not overweight. There's a false understanding that people who are fat have back pain and skinny people don't. It's not true. Back pain affects everybody. It doesn't matter what your weight is. And I can tell you with 100% certainty, losing weight doesn't make a difference. Now, some people will lose weight and they say their back pain gets better. I'm happy for them. But that's not a consistent finding. And I don't ever pass judgment on people telling them, you have back pain, go lose 50 pounds or 100 pounds before you consider getting your back pain fixed. Because if you do that to somebody, you're basically committing them to 2 or 3 years at a minimum of trying to lose that weight safely before you'll treat their back pain. So this patient is in great shape. She's very thin. She has no body fat whatsoever. She comes to us from Switzerland, and she's had back pain for 6 years. You could see with that 6-year history of back pain, her disc was completely collapsed. We call it a degenerative disc disease, and it all comes about because of inflammation happening in the back of the disc within the tear called the posterior annular tear. And that posterior annular tear is the source of the inflammation that spreads throughout the disc, eventually making the whole disc degenerate or dehydrate. For years we didn't understand this, and now at Deuk Spine Institute we've uncovered the truth. We've shed light onto what's happening so that people out there can understand why they're having back pain and can come here to Deuk Spine Institute to get it fixed. All right, let's move on to our first question.
Yes. The first question comes from Janet Parker on Facebook, and they asked, what can people do to make this more widely available?
Janet Parker, you okay?
Yeah.
You need to go wash your face?
I got eye drops somewhere.
All right.
Yeah.
I sometimes get chemical in my eye and I have to go wash it to get rid of it. But so the great question from Ms. Parker, what can people do to make this procedure more widely available? There is something you can do, and that is, number one, most importantly, demand it. Demand it from your doctors. Don't settle for surgeries that benefit the doctors more than they benefit the patients. Think about it. How ridiculous, in my mind, how ridiculous it is that doctors would treat patients in a way that's best for the doctor and not for the patient. Are you kidding me? To me, it's insane. Insane means like crazy, okay, for those of you who are international. Doctors are not supposed to do what's best for themselves. They're supposed to do what's best for the patient. Well, how do you do that? You got to, first of all, be able to know what's best for the patient, okay? I'll give you an example. I'm a neurosurgeon. Neurosurgeons treat brain problems, they treat spine problems, we treat nerve problems. We treat adults, we treat kids. Okay, I am a neurosurgeon. I'm the best, most qualified doctor to treat brain problems, like aneurysms. An aneurysm is an abnormal blood vessel in the brain. I will tell you this, I have not treated an aneurysm in 20 years. So even though I'm qualified to treat an aneurysm, I've been trained to treat an aneurysm, I won't do it. Why? Because I am not the best treatment option for the patient. I, Dr. Deuk, am not the best treatment option for a patient with an aneurysm. Now I could say that 500 times. I'm not the best treatment option for hydrocephalus. I'm not the best treatment option for a skull-based tumor. I'm not the best treatment option for an arterial venous malformation. So I could keep going. There are literally hundreds of types of surgeries and treatments neurosurgeons do, but I'm not the best at all of them. I'm only really good at endoscopic spine surgery and fusions and artificial discs. So basically, degenerative spine surgery. So the key here, if you're listening carefully, is I am realizing, I am recognizing, and I am acknowledging and coming to grips with the truth, which is that one doctor cannot be the best at everything. They have to understand their limitations. As Clint Eastwood once said, a man's got to know his limits, okay? And it's true. We have to know our limitations. We have to stop trying to be everything for everybody. We cannot do that. So be really good at something and be the best at it in the world and treat those patients with that problem, okay? That's what I've done with endoscopic spine surgery. So what should doctors do? If they're not able to provide the patient the best treatment, they should refer the patient somewhere else to the doctor that provides the best treatment. The problem is doctors, especially spine surgeons, are egomaniacs. They never want to accept the fact they're not the best at doing something. Heck, I even tried training spine surgeons to do the endoscopic surgery, which is a far safer, better surgery than open surgery. They don't want to learn it because they think already, hey, if this is such a good surgery, I would already know how to do it, right? That's what they truly believe. So they, in their head, they've convinced themselves that if they don't know how to do the surgery by the time they're done with their neurosurgery program training, that it's not a good treatment. It's ridiculous and flawed, obviously. I laugh about it because it's so obviously flawed, yet so many of these spine surgeons actually believe they're doing what's best for the patient when they're not. So the first thing doctors have to do is recognize that they have limits to what they're able to do. And they have to recognize that there are better doctors at treating certain conditions than they are. And they have to be willing to send their patients to those doctors. It's all about honesty and accountability. It's all about being secure enough with yourself to be able to say, hey, I'm not the best at everything, okay? I think that's important. So what can people do? Well, people need to recognize that their doctors are not going to be the best at everything, and that they have to select a doctor who is the best at what they need done. For example, when I had my sinuses treated by a doctor, I picked the very best ear, nose, and throat doctor that I knew that I could have access to do my surgery. Turns out he had to do 3 surgeries to get it right, but I still tell myself, well, if I went to the bad doctor, I might have had 7 surgeries. So, fact is, we all have to make choices at some point. Deuk Spine Institute makes the choice easy for you. You go to Deuk Spine Institute, that's where you're going to get your back and neck pain cured. You're going to get it cured, not just cured, but cured in the safest way possible with the lowest chance of complication and the fastest return to normal life. That's what we offer our patients. That's what we're committed to doing. So I'm sorry I can't fix all the surgeons out there, but I can fix the people looking for surgeons, hopefully if they listen to me and they're willing to search for the right doctor to fix your problem. So it's really upon you all to make this procedure more widespread by demanding your doctors perform it. And if they won't perform it, don't settle for the garbage surgery they're going to give you that's bad for you. Move on and go to Deuk Spine Institute. If enough patients around the world, like this patient coming from Switzerland, leave their doctors, come here, get this surgery done, you will send a message to your doctors. We will not stand for inferior surgeries. We will not accept bad spine surgery from you. You are going to have to change what you're doing. You're going to have to learn the Deuk laser disc repair, or we're going to leave and go somewhere else. That's how you make change happen. It's up to you to do it.
Next is comments from Woody on YouTube.
Woody, welcome back.
And they said, I had a consultation with London Spine, and they told me they told me endoscopic won't work, and I be back for a fusion. Letter sent to Deuk when I had my MRI consultation. They're shocked that they lured me as advertised as endoscopic.
Letter sent to Deuk. Oh, we're shocked.
I think it's shocked that they. Like, I'm shocked that they lured.
Yeah, thanks, Woody, for sharing your experience with London Spine. I don't know London Spine Institute at all. I don't know the people personally there, but I'm hearing some chatter from people around the world that study their treatments and their kind of strategies. I have nothing bad to say, except I just heard today that they are copying our website and our procedure and advertising. They do the Deuk laser disc repair, which they don't. And that bothers me. I'll be honest with you. The thing that bothers me the most, the thing that bothers Dr. Deuk Majin the most, do you know what it is? Dishonesty. Dishonesty. Look, if you're going to trick people, then just be honest about it. Tell them we don't offer this surgery, but we offer an alternative, and let them decide. When you're honest in life, it forces something to happen. It's quite incredible, actually. It forces you, the person who's being honest, to have to assess what it is you're believing, and you have to really make a determination as to whether what you're doing is right. So if you're offering a type of treatment to a patient that's not good, and you know it's not good, maybe you shouldn't be offering it. Maybe you should be honest with yourself. Maybe you should be honest with everybody and tell them the truth. The fact is, I can do any spine surgery in the world. There's no surgery I cannot do. Spine surgery is easy for me. Even the most complicated spine surgeries, I've done them. And the reason I recommend the Deuk laser disc repair without hesitation is because it is the very best surgery in the world. The reason we promote it, it's the best surgery. The reason we do it, it's the best surgery. It's not because we discovered it here. It's because it truly is the best surgery. The fact that we discovered the surgery here has nothing to do with the fact we promote it. You understand? Because if you came to me with an aneurysm in your brain, I don't do the aneurysm. I'm not the best at it. I'm going to send you to somebody else. I'm going to promote for you to go elsewhere. So what I'm saying to you is, I recognize I'm not the best. I don't have the best treatment. I'm going to send you to somebody who has the best treatment. And so when it comes to spine surgery, I can do all the treatments. I'm perfectly capable. I've been trained. However, I choose not to do those other treatments like fusions because I know that these surgeries cause problems for people, big problems, problems that are the kind of problems you don't sleep at night as a doctor when you recommend those treatments, knowing that you gave them the wrong recommendation. So I sleep very well at night. Why? Because I'm honest with my patients. I'm honest with everybody. And if I'm bad at something, I'll tell you I'm bad at something. If I know that, if I don't know that, maybe it's time I find out. Somebody could let me know. I'm not perfect. You know, I have lots of flaws. I'm not a patient person. And that's probably my second pet peeve besides dishonesty is people who waste my time. I don't have time for them, okay? I don't have time for them. I hate it when people waste my time, especially intentionally. It just shows a lack of respect for my time and effort. I have too much to do. So, long story short, I don't know what London Spine does. They may do endoscopic surgery. They do not do the Deuk laser disc repair. I know they're trying to steal patients by advertising the Deuk laser disc repair. But beware, there's going to be a lot of people in the future coming up very soon based on our results. They're going to see how good our patients are doing. They're going to want to do what we're doing. And I don't mind if they do. I'm happy to help them do it. But they have to be trained to do it properly, and they have to have the right equipment, the right staff. They have to be able to do it safely and effectively. So people ask me, will you train other surgeons? Absolutely. But I expect those other surgeons to do the very best for their patients, just like I would. Because I don't want my procedure being used to harm people. That I would not sleep well at night, okay? And that's the main reason I haven't taught anybody else the procedure yet, is that I need to find good surgeons who are conscientious, capable, intelligent, and want to provide the best, highest quality service for patients. And those are the ones that I'll take my time to train. Otherwise, it's a waste of my time because I'll never be happy training a shitty surgeon to do bad surgery on somebody and being responsible for that.
Next questions are from, I'm not going to pronounce this last name, first name. Last name is Maximilian. And questions are, how long is the recovery and was the surgery successful?
So Maximilian, thanks for asking. How long is the recovery? This surgery was successful. How long is the recovery? It'll be 1 hour. In 1 hour, she'll be fully awake, walking around. The only thing is she can't drive a car because she just had anesthesia. But tomorrow she can drive, she can shop, and she can fly back home to Switzerland. So the recovery is 1 hour, or if you'd like, 1 day before you can start driving and going back to work.
And last series of questions come from Janet on Facebook, and she asked, is it just greed that is making the doctors do the old barbaric surgery, and why are they not taught this in school?
Yeah, Janet, it is greed. That's why the doctors are doing these spine surgeries. I hate to say it. It's true. I never believed when I went into medicine that there were so many doctors that were so greedy and put their needs way ahead of the patients. If you told me that, I wouldn't have believed you when I was in medical school. Okay? Why? Because I'm a son of a doctor. My father was a doctor, and I grew up with him. He loved medicine. He loved going to work. He loved patients. He loved taking care of patients. He loved talking to patients and figuring out what was wrong and treating them. That was his passion. Okay? And he was an OBGYN, which I would never become an OBGYN ever. I would do a lot of things before that. I just can't do that. But anyway, the point is that he loved the doctor-patient relationship. He loved healing people. He loved delivering babies. He said it was the best time in life for people because they had a baby. So I grew up with a doctor who was a real doctor. And not all doctors are bad doctors, don't get me wrong. But I think spine surgery and pain management draw the wrong kind of people to that profession, to that area of medicine. I really do. I know some very good doctors that are not in spine surgery. I don't know any good doctors in spine surgery. I don't. I really don't. I'm sorry. And there's thousands of them.
And that is it for questions.
Yeah. Well, I'm happy you're all here sharing conversation with me and exploring ideas and thoughts and questions, and I'm happy to answer them. I'll always answer them honestly. I'm 53 years old. I am successful, very successful already, and I've got nothing to prove to anybody but myself and God. And basically, I'm here because I choose to be here. I want to be here. I don't have to be here. I have no debt. I don't owe money. I've paid off all my debts many years ago. I have plenty of money in the bank. I could retire. I could live on the beach nicely and drink the finest wine and champagne every single day for the rest of my life without making another dollar. But I'm here because I know there are millions of people suffering with back and neck pain, and they are on the verge of becoming victims of bad medical care by surgeons and pain management doctors, by a system that basically doesn't see them as a human being, but sees them as an opportunity to try to get rich. And they never get rich, by the way, these doctors. They never get rich. Some of them do. Some of them do very illegal and unethical things to become very wealthy, far wealthier than me. But most of them are never going to be satisfied with where they are financially, and yet they continue to treat patients like they're an investment and just looking to squeeze out more money. So I'm here because I really truly believe I'm alone in a lot of ways, and that if I'm not here for you, that you guys will continue to become victims, and it'll get worse. I just see it getting worse. So I'll tell you about a movie, since we were talking about movies today. There's a movie you should watch, and this movie epitomizes who I am. And I had my son watch it with me this week. It's called A Fistful of Dollars. A Fistful of Dollars. Now, if you don't know what this movie is about, it may seem bad that I'm talking about a fistful of dollars to you. But if you've watched the movie and you know what this movie is about, and you understand the meaning and the message of the movie, and it's a Clint Eastwood movie, it's a spaghetti western with Sergio Leone as the director. It was made in the 60s, 1965, before I was born. And it's a story about a man who comes across a town that is kind of the same way spine care is right now in the United States. Dominated by evil and greed and lawlessness. And that's the way I see spine right now. And so this man, who's obviously Clint Eastwood, the main character, he comes to town and he does something that in the end you understand it, but you don't understand it till the end of the movie. And basically, I don't want to spoil it for you, but the end result is he cleans up the town and gives it back to the good people of the town. And he gets rid of all the bad guys. And in the beginning, you have no idea that's what's going to happen, but that's what he does. And my son asked me, why would he do that? And I said, because he wanted to, because he's a good person, because he saw victims and he put his life at risk, he put his career at risk to save these people. And that's what good people do, okay? So I'm here for a reason, a purpose, and I'm not going to stop. And, you know, it frustrates me to no end that these videos that I broadcast for an hour or two, and I talk about the philosophy of Deuk Spine and myself, and we share people's experiences, they get like a few hundred visits. But, you know, some woman in a bikini with an oiled body gets millions of views. And that bothers me a lot, because I feel like we have our priorities all screwed up, especially considering how many people are out there in back pain. And they're still in back pain. They don't even know that there's a cure. And yet, everybody knows who the next Instagram model is, or we all know who LeBron James is, or some famous football player. We should stop prioritizing entertainment, and we should start going back to prioritizing science, research, teachers, good people in society, ones that try to help others. Okay, these athletes, these entertainers, they don't care about people for the most part. There's some exceptions, but for the most part, they're very greedy people. They take a lot of money. They don't do much to help society, really to help society. And so I think we need to change our priorities and put it back to supporting people who actually are there for the greater good of the community and society. All right? Anyway, that's what I'll leave you with, that sentiment. Go watch A Fistful of Dollars, and hopefully you'll enjoy it as much as I did when I first watched it about 30 years ago. All right. Thanks, Henry. Great job today. And we'll be back next week, right? Tuesday, for some more live spine surgery coverage from Deuk Spine Institute.